Today we are going to discuss about the lungs. So what is the definition of the lung? Lung are the pair of respiratory organs which are situated in the thoracic cavity, and each one lung we are having the right lung and we are going to have the left lung. They are situated in the thoracic cavity. Each lung are covered or invaginated by the covering of the lung called as the pleura. So here we have the right lung covered by the right pleural cavity, and we are going to have the left lung is covered by the left pleural cavity. So in the introduction, you have to remember the lungs are the pair of respiratory organ. Like you can compare this how the kidneys are the pair of excretory organs. Like that, we have the lungs are the pair of respiratory organs. In the introduction, we have the lung, which is in the end we have the brownish color, but they becomes afterwards blackish in color due to the deposition of the carbon particle. That is, we are going to have the call as a mottled black color because of the presence of the, that is the one which is you are going to get as a, that is a mottled black color. So here you have to remember the structure of the lung, spongy in texture, which is you are going to get spongy in texture, and as you can see here the blackish dot, which is where we deposition of the carbon particle. So in the introduction you have to explain what is the definition of lung and where they are situated and what is the covering of the lung, that is the pleura. Separately we are going to have the dealing of the pleura. Next, when you see this is a right lung and this is a left lung, which is you can see how to identify the right lung. You are going to get the simple way to identify. We have the normal cuttings, those we call as fissures, and here we are going to have right lung has one is a horizontal fissure and other is a oblique fissure. So you can see the very well fissures of the lung, which divides the right lung into upper lobe, mid lobe and lower lobe. So anatomical position of lung you have to hold in this way, because both the lungs you are going to hold in the anatomical position, so that in the centrally there is a situation of the heart and pericardium. Covering of its heart is pericardium. So here you are going to have the anatomical position of the lung. Because of that, you can have here also we have in the left lung one oblique fissure, that is cutting totally length of the lung except at the root of the lung or the hilum of the lung. There is a cutting which crosses that is the root of the lung. Next, you have to remember about when you see the weight of the right and left lung, you are going to have the maximum, that is the right lung is heavier than the left lung. So right lung exactly, or maybe it is a 700 gram, and we may have that is a higher 100 grams or the 50 grams than the left lung. And it's also we have the wider and elongated, that is the right lung. So next, in the general feature or external features of the lung, each lung what it is consists you have to tell. After the weight, you have to mention each lung is having the apex, and this is the one which we call as a base, then anterior border, and this is a posterior border. Then we are going to have this is the inferior border. So three borders, anterior border, then this is the one which you have to remember about the anterior border, and this is a posterior border on this. Then we have this is the inferior border. So we are going to have the surfaces. This is a base which is separating from the inferiorly diaphragm with the inferior border to this is the costal surface. So that you have to remember the lung is having the two surfaces. One is we call as a costal surface, and this is a mediastinal surface. In this mediastinal surface is again divided into a medial and vertebral surface. This we can call as a medial, and this is a vertebral surface because vertebrae are related. Medial, almost all the root and other structures of the heart related, mediastinal structures are related. Those we call as that is a mediastinal surface relation and vertebral surface relation. So that lung is having the one which is a medial surface and costal surface, and this medial surface is divided into a mediastinal and we call as a vertebral surface. Next you have to go to the what are the surface. This costal surface from the inferior border, it is separated the base and inferior border, and this is the we call as that is a costal surface. Here anterior border of the right lung is a straight, whereas the left lung you are going to get it is interrupted by the cardiac notch. So this is the left lung when is two lobe, upper and lower lobe, and one oblique fissure, and here you have the anterior border of left lung is curved, interrupted, and that is we call as that is the cardiac notch. And tongue-like, which is we are going to get the tongue-like, which is projections or tongue-like in the upper border, that we call as a lingula. Lingula is a characteristic feature of the left lung. So cardiac notch and left lung, they are present in the that is the left lung. So right lung is the anterior border is you are going to get the straight one. It does not have any lingula and cardiac notch. So posterior border is ill-defined. Inferior border is a prominent, but it is separating from the base to the costal surface. So both the lungs you can see that is the in the left lung you have the anterior border making the cardiac notch, and the tongue-like projection we call as this is a lingula. Okay, so this is the one which you can clearly see the fissures of the left lung, that is a oblique fissure. Next, going to the what are the structures or the relations of the mediastinal surface of the right lung. So when we go to the right lung, hold in the anatomical position, this is the anterior border and we have the mediastinal surface, and in this mediastinal surface we are going to get the relations like here you have the relations in the anteriorly we have the right atrium. We are studying now the relations of the right lung. So right lung mediastinal relations are here we have the right atrium. On the upper part here we are relation of the superior vena cava. Inferiorly we have the inferior vena cava. So inferior vena cava, here superior vena cava, here is the right atrium relations. On the other side here little laterally going to that is the azygous vein. Azygous vein opens into the that is the superior vena cava. Next, on the posterior aspect, we are going to have the relation of trachea and esophagus. Then we get the nerve which is relating on the anterior aspect, that is a right phrenic nerve, and going posterior here hilum crossing right vagus nerve.